Hey, LinkedIn, and welcome to Business Unusual. This is a live show where we talk about the ways coronavirus is impacting the way we work and the way we live. I'm Susie Jackson. I am a news editor at LinkedIn and your host today, coming to you live from my home in New York City. I am really excited to talk to an important group of people on the show today, and that is healthcare professionals on the front lines battling COVID-19. The nature of work is changing for all of us. If you are an office worker, you are probably working from home right now. You are working different hours. If you are an essential employee, you are facing increased risk and challenge every time you step out the door to perform your job. And work has changed dramatically for medical professionals as well. We are seeing pop-up hospitals appear in parks and in convention centers. We are seeing medical professionals welcome colleagues back into the fold of the ER and the ICU who have not been in those rotations for a while, trying to get them trained up, trying to form cohesive units with everyone pitching in, with protocols changing all the time. I want to hear from you on the show today. Are you one of these medical professionals? How are you? What has this process been like for you? How are you feeling? I want you to talk to me, talk to each other in the comments. We're going to get to as many comments and questions as we can throughout the show today. Do you have a family member who's in the medical profession? I have a sister who's a nurse. I'm thinking about her during the show and what she's been going through with the way her work has changed and how she's trying to manage her staff. Do you just want to say thank you to the medical professional at large? Please do that in the comments as we talk to these nurses and a doctor today. With that, I'd love to bring on our panel. We have Kathleen Williams. She's the hospital administrator at Mercy Hospital in Springfield, Missouri. Natalie Carell-Yoder, a critical care nurse at the North Bay Medical Center in Fairfield, California. Rosemary Yetman, an emergency department nurse at the Mount Sinai Health System in New York City. And Dr. Cornelia Griggs, a pediatric surgeon at Columbia here in New York City. Welcome, everyone. Thank you so much for being here today.
Thanks for having us.
Thank you. Thank you.
Wonderful. I really want to hear from all of you. You're in different parts of the country. You're approaching this crisis in ways unique to your hospital, but shared in that you're, I hope, all working from the same information, the same guidance. Tell me what it's been like. Rosemary, let's start with you. You are an emergency department nurse in New York City in the epicenter. What has your new normal become?
Hi. So the new normal is no normal. We have to be able to adapt to changes in the patient population, cases, new information that are coming up to the forefront, and the patients that are coming in that are not COVID and COVID. So we really have to adapt on the fly. And that's the expectation. And we have definitely acclimated to that.
Yeah. So new normal is there's no normal. Natalie, I'm curious, what is your take on that? I know that you are running two ICUs. Have you found a rhythm yet? And if so, what does that look like now?
I don't think I have a rhythm yet. I think, there is no normal, where every day is a new day trying to figure out what approach we're going to take. With trying to get PPE to staff and make sure they're fully trained. My job is a clinical nurse specialist, and so I am responsible for making sure they know how to take care of these patients, how to dress for these patients, how to protect themselves. And so we constantly go over the procedures. We constantly support staff in trying to do what they do best, right? And not have to worry about the trying to find a mask, but making sure things are at their fingertips.
Yeah, and as I think we've heard a lot of news stories about supplies being limited in some areas. How did you find your way to that new normal, at least in how you're teaching people how to properly protect themselves and those new protocols?
So we have a great team that we put together. We were fortunate enough, actually, to have a patient in February in our institution. It was one of the first known patients in California. And so it gave us, I think, a wake-up call to really get ready for the pandemic. And so we started working immediately. We put together a command center of our leadership and infection preventionists, and they set protocols and standards based on what we had available that day. And so then every day we would go out with, this is what we have and this is what we're going to do. And we just kept communication flowing and then re-clarifying when people were confused because it was happening so fast.
Yeah, I think communication is going to be something I'm expecting to hear from a lot of you today. As information's been changing so rapidly, keeping those clear lines of communication open seem really important as information keeps changing. I wanted to say hello to a few people joining us from the stream. We have Stuart from Vegas, Mohammed from Dubai, Joanna is from San Francisco, Joseph from Florida, Monica from India. Hello, thank you for joining us today. We are talking to healthcare professionals on the front lines, a group of nurses and a doctor here. We have Ernesto who says, thank you all medical pros for what you're continuing to do through this time. Yes, thank you. We're going to have a lot of thanks from the stream today. I'm going to get to as many as I can because people are already really excited to be hearing from you. Kathy, I want to go over to you for a moment. You had a role change during this onset of the COVID crisis. Can you talk us through what that was like? What were you doing before this really hit, and now what are you doing?
Well, similar to what the others have said, everything is different. Every day is different. My role actually is a critical care fellowship coordinator. So I do a lot of teaching and onboarding with our new critical care nurses. And as far as the role, for example, when we first started getting hit with so many sick COVID patients on vents, and then we realized we had to prone them. Well, I shouldn't say there weren't enough people, but we had to train some new people who were not the ICU nurses to do the turning. And that kind of came on suddenly in that they got so sick so fast. So we did some training on the weekend, and I came in to help with that so that we could properly have techs and other nurses who are non-ICU to support our critical care bedside workers.
Yeah, I think we're going to get to some questions about that in a little bit too, about you're working with people who are maybe a little bit rusty in the certain skills that you need while you're also all learning new skills together. So I definitely want to get to that too. Cornelia, for you, you wrote an op-ed in the New York Times about a month or so ago saying that the sky is falling. I am really curious. You are also here in New York City in the epicenter of this crisis. How do you feel now? Is that still true? Do you feel like we have a handle on it? Where do you see things going?
Well, it's so hard to predict the future in this pandemic. I definitely feel that the situation in New York City hospitals, and especially my hospital, is improving and getting better every day. I think all the data suggests that we are over the hump of the peak surge in what we can consider at least the first wave of this virus. Our PPE situation is much better, which I think gives a lot of the healthcare workers at my hospital in particular a greater sense of reassurance. And the challenge now going forward is how do we rebuild and reorganize to sustain what may be a plateau of sick patients? Because I don't think we're going to see the virus completely go away anytime in the near future. But we do have to figure out how to rebuild and begin to phase back in some of our more standard and elective procedures as we also cope with patients who continue to come to the hospital with coronavirus-related illness.
Yeah, I think that's a good point to remember, is that life still goes on outside of this. And I think a lot of people have questions about how should they best manage their own care for other issues that are not coronavirus related. We have a few more people saying thanks to you all in the stream. Edward says, our heroes in all capital letters. Thank you for your humanity, sacrifices, and love. Aaron says, thanks a gazillion for your bravery. Also in all caps, you are the heroes today. And he's doing a little arm flexing emoji there for all of you. Natalie, I want to talk to you. We've talked about coworkers coming in who have different experiences. Maybe they've been in the ICU recently. Maybe they haven't been. They've been out of rotation. What has it been like to train people? They're eager to come in. They want to help, but their skills might not be exactly where you need them to be on day one. Yet it's really crucial that they get there as fast as they can, even as things are changing, as the information is coming in. How are you dealing with that?
So we put together a plan, a surge plan, in order to identify what are those skills staff would do when they came in. And there were two parts to that. The first part was to look at our nurses within our facility that had worked in ICU in the past. And so we invited them to come back and have a refresher to buff up their skills and get ready and for the surge. We actually haven't had our surge, so we're still waiting. We keep having little peaks in our community, and so we're expecting those patients to come. But we've had enough patients for us to be challenged. And then we've also invited acute care nurses who are interested in ICU to come up and work side by side with our ICU staff, doing the things that they know how to do. So the skills they do on the floors, we would have them do in the ICU under the supervision of an ICU nurse, so that the ICU nurse would be responsible for the patient, but the acute care nurse could do certain things like passing oral meds or checking the intake and output, hanging IVs, all of the things that they normally do. They could assist the ICU nurse that would then free the ICU nurse up to do other things. And that's been a successful plan. And the staff that came up were volunteers, and so they were people who were excited to be there. And that's gone very well.
That's a great way to roll that out. You're keeping people safe. You're relying on skills that the people who are employing them feel confident in, but still finding a way to make the whole work more efficiently. Kathy, I know that we've talked before about not all nurses are the same. Some are drawn to different specialties because it really motivates them because of their skill set. But now you've got people like we're hearing that are coming in from all areas of the hospital and they just want to help. How do you build cohesion with people who are used to working in different ways, who are maybe used to different pace of their work? And in these extreme circumstances, there's a lot of stress going on too, but you really need a team that's going to work together, function as a unit, and pull for each other. Can you talk to us about how you've tried to manage that with your teams?
A lot of support, a lot of encouragement, a lot of just telling them they're doing a great job and that they're doing the best they can with what they have. And it may not be the most comfortable thing. There's a lot of fear. They're a little afraid they're going to do something wrong. But the encouragement that we've given them the resources through AECN and several other professional organizations that give us some just-in-time training to help support them. We give them the manpower. There's plenty. We've had actually plenty because all our elective procedures were canceled, that we have all these OR nurses and recovery room nurses that are there. And some of them, it's an awkward role for them, and others, it's like coming home. So we support them in any way that we can with encouragement. We also provide a lot of break rooms, like massage chairs, and help with our human resources and our mission team to help them feel comfortable and supported.
Yeah, encouragement's a word that I'm picking up on too. I'm thinking of interactions with not only with each other as coworkers on the medical front lines, but I'm thinking about interactions with patients and their families. Rosemary, you are now covered in gear from head to toe. What has it been like have you lost any of that human connection? What is it like to be at the bedside when you have to don all this equipment that takes extra time to even come into the room, I'm assuming? Tell me what it's like to interact with people in this way. Have you had to learn new ways of doing it?
Yeah, that's very true. Because you have to don and doff, and you have to consider the length of time that you can wear equipment for. You really tend to batch care, and it does take away a little bit from the patient experience, that nursing touch, that connection, with just being there sometimes. But I see also nurses finding ways to, just to penetrate through that as well. Really connected with certain patients. They're feeling scared, connecting families, answering questions for those on the phone that are concerned for their loved ones, and just relaying those messages back to the patient and vice versa. I see people coming up with really creative ways to improve on that aspect of patient communication and that nurse-patient relationship.
Yeah, on the thread of relationships and communication, Cornelia, I'm wondering, have you had to have any hard conversations with families and you're not in person? Or if you haven't, have you seen colleagues have to wrestle with that? And how are they figuring out a way to do that in a way that feels as best as it can on both sides of it?
Absolutely. I think Rosemary mentioned a really important strategy, which is harnessing technology in ways that we haven't typically used in the past. It absolutely erodes the doctor-patient or nurse-patient relationship when your care provider is cautious about even going in the room, and it puts up a wall in terms of fear and a layer of protection that we're not used to putting up between ourselves and our patients. And I've had to have difficult conversations with families. Usually, if I'm consenting a patient for surgery or discussing an invasive procedure, that's a conversation that I'm going to want to have over the phone. But so many of our patients' families can't even come to the hospital. And so we're learning to use, video conferencing, FaceTime, calling families more often to keep them in the loop. We have had an amazing team of interpreter services to help us connect more with our patients' families who are not English speaking. I mean, technology is being harnessed for telemedicine and in ways that we've never really employed it on this scale or this level in the hospital before. And that has helped a lot, but I don't think it replaces a hug or a handhold or really being able to sit side by side compassionately with your patient.
Yeah, I that's so hard. Thank you for sharing that. I think a lot of people have had questions about that and are probably experiencing that themselves, having loved ones in critical care situations. I just wanted to reintroduce the show. This is, if you're just joining us, Business Unusual. This is LinkedIn's live show talking about the way coronavirus is impacting the way we work. We have a fabulous panel of medical professionals on the front lines joining us from across the country. Cornelia, I want to go back to you for a moment. We have a comment in the stream, or a question actually, asking about reopens. Latasha wants to know, what are your thoughts around the government opening up some parts of the country, knowing that lives will be lost? And then Kathy, I want to hear from you too on that. You've mentioned that you haven't seen the peak yet at your hospital. So Cornelia, can you take that one first, please?
Sure, absolutely. This is such a difficult question and an impossible choice that our government officials are facing. And I think, again, as I mentioned before, predicting the future in the face of this virus is so very difficult. And I think that based on the data that we have so far, our government officials have to make the best decisions that they can in order to keep transmission as low as possible, while also reopening some of our most vital centers of economy, because as people lose income and lose their jobs, poverty is going to take lives from us in a different way than the virus does. And it's an impossible choice. I have no good answers. I feel fortunate as a doctor that the recommendation I can give everybody is stay safe, stay at home. If you ask me, it's not worth losing any lives, but our government officials face a much more difficult choice in that decision.
Yeah, I think that no one knows the answer is the answer. But Kathy, I'm interested in your perspective as someone who hasn't hit the peak of it in your region yet. What are your thoughts on that?
Well, I feel like St. Louis area, we probably have plateaued at this point. And in our own facility, we're starting to see a little bit less admissions with it. So we're starting our reactivation process. And some of that involves educating the nurses on what that will be like, talking to our physicians and colleagues to see how much you open, when, what's the rollout, what's the impact, and how much social distancing and PPE is going to be required for our patients, and to understand before they come in what's going to be expected. And it can't all happen at once. And just using thoughtfulness to be safe. And I really applaud our leaders trying to do the best they can. In a whole state like Missouri or like other parts of the country, it's not all the same. There are pockets of our state that have very little to no coronavirus presence, and St. Louis has quite a lot. So we're going to be a little behind because we need to make sure it's safe to open and reconvene.
Yeah, safety is paramount. We have a few people joining us from the stream who are also healthcare workers. Leslie says she's an ICU nurse. She says that she's found this time to be very difficult. Zabene is a medical technologist working in the diagnostics front. And we have Jerome, an RN working out in the field in doctor's offices, saying that at first his employer wasn't providing masks, but I hope now is. Natalie, I want to go back to you. I want to talk a little bit about the mental well-being of your staff. This is really grueling work. I mean, I think everyone who's experiencing something new is thinking, when is this going to end? When am I going to go back to normal? But then when you mix in that you're on the front lines, it is really stressful. You are actually dealing with life and death situations. How do you manage your staff's well-being physically and mentally? We see pictures of workers with sores on their faces from their protective equipment. This is not easy stuff. How are you thinking about supporting them?
Well, we try really hard to do a regular check-in with our staff to make sure that they are emotionally and mentally intact as well as physically, and they're ready to take care of the patient again the next day. We haven't had the volume that they have had in New York, so it's been easy to rotate assignments to give nurses breaks. The other thing that we did within our ICU is we created a quiet room for our ICU staff where they can actually go and have some respite and step away and out of the environment and just take time for themselves. And then organizationally, our organization has been very thoughtful about that, from the administrators doing frequent rounds and talking to staff and making sure that they're doing okay, from our nurse executive and our president. And then also our HR department sends out a daily video for peace of mind and meditation and stretching that just takes maybe 5 minutes that we can get the staff engaged in to do to just take a break. So the thing about California too is we do have ratios, so we are pushed a little more than some hospitals to ensure our staff get breaks. And we all know when it's busy, it is hard to do that, but we strive to get every nurse out as much as we can to have that time to themselves.
That's great that you're thinking about this holistically. Rosemary, I'm interested in your experience with this kind of thing. When you leave the hospital, are you able to decompress and process what you've seen throughout the day? What has that been like over these 8 or so weeks?
Yeah, like in the beginning, it has been very, 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 very hard. It was everybody I know was ridden with anxiety and maybe insomnia and just that what if factor. And, but now I think that our hospital has really like helped us out like with crisis management. I really think that they have also put our holistic mental health well-being on the forefront. We too have also been every time we have a discharge, right? We play music, people clap for the patients that are being discharged from the units. And that makes us feel good too. We also have the thank you hour at 7 p.m. where everybody comes out in the neighborhood. They block off the street, the fire department's there, the police officers, the citizens, they clap and they show us appreciation. That helps us rebuild our stamina. The hospitals, people are bringing food. We don't have to buy anything. We have quiet time as well. Like we have our Zen moments. The hospital administration, they rotate staff members as well, offer us a little bit of time off in between our shifts so we can rejuvenate. I can't explain enough the level of involvement that everyone from the top down to the bottom, down from the bottom back up to the top, like literally everyone is being extreme team players. Even our travel assignment nurses that are coming in, we literally locked arms and we just embraced each other and we're like literally in this together. It's been a complete turnaround.
You're making me choke up a little bit because 7 p.m. here in New York is one of my favorite times of the day too. It's really amazing to hear people outside. It sounds like you're at a sporting event or something, and just to hear that energy coming through when everyone's been so in such solitude is incredible. I'm really, really glad to hear that you hear that and that it makes a difference. I have a question from Diane in the stream who wants to know, she says she's been using a UV light wand to disinfect masks and other protective equipment. What are you all doing that it's working? You have to hack it together. Are you not even doing that? You have enough supplies? Cornelia, can you take this one first?
Sure, absolutely. I think our PPE situation in my hospital in New York is a lot better. I'm able to get a new N95 mask for the day, every day. I still do reuse it for all of my cases and procedures throughout the day, which is still a deviation from the normal. It's usually a one use and discard kind of mask. But in order to conserve PPE as we move forward and deal with the uncertainty of what our PPE stockpile will look like as more and more businesses do reopen, I do think it makes sense to still conserve. And so, in terms of masks and gowns, we're still in a fairly good position with that. So I am able to refresh my N95 mask more often than I was at the peak of the pandemic. And that's very reassuring.
reassuring indeed. Moving in the right direction, not quite there yet, but good to know that it's not as dire as we've seen in other situations with medical professionals and trash bags. Kathy, what about you? Do you have any tips for people who are trying to make things work until we reach a better state in terms of equipment?
Well, in terms of equipment, we've just all been very aware of the potential for it being scarce. Fortunately for us, our leaders have positioned us in a great situation with supplies. We do reuse them, like Dr. Cornelius was saying, and recreate, not recreate them, but resanitize them. As far as our staff, though, just keeping them to focus on the positive, and that there are so many positives. And just like some of the other panelists said, within our community, within our own healthcare system, one of the things that's been very encouraging is in St. Louis, the major health system leaders, the CEO, presidents, and chief nursing officers get together on a daily basis, and they share data and techniques, and we're all on the same page doing the same thing. It's like no competition. We're all here together to support the community. And our community has just been amazing, just to help our nurses feel better. And I tell them, focus on those things that help you feel better.
Yeah. Community is so important. And it's a great question coming in from the stream right now from Karen, who says, besides food, or maybe it's food, what can people in the community do to support the healthcare frontline workers? Let's see, we haven't heard from Natalie in a minute. Can you take that one first, please?
Well, I can give an example, actually. This is Nurses Week, and one of our local florists donated an orchid to every nurse and actually hospital employee, and they were just distributed yesterday. And so every single one of us got an orchid, and mine's actually sitting over my shoulder. So I get to look at that every day and think about how fabulous it is that our community cared about us that much to give us such a beautiful gift. And then we have food as well. And so there's several days during the course of the week where different restaurants in the community will send us food for everyone, not just the nurses, but for everyone. So we got pizzas one day, and today there's burritos, and it's just so meaningful that they're giving to us in that way. It makes a huge difference. It lightens the stuff.
Yeah, your lunch is going to be better than whatever I'm scraping together here. Dr. Griggs, what about you? You're in New York City as well. I hope we're hearing that 7 p.m. cheer. What else do you think that people in the community should know about if they want to find out ways to support the work that you are all doing?
I think these are all really lovely examples of ways that our community is expressing their gratitude for healthcare workers, and it means so much to us, and it really is uplifting when you hear that 7 p.m. cheer, or you see all of the outstanding members of our community that have donated food and other services to support our fight. The other thing I would say to everyone out in their community is, even if you don't have the resources to make a donation or give food, taking care of yourself and keeping yourself and your family healthy at home, that's providing healthcare. That's keeping you out of our hospitals. And that means the world to us. Looking out for an elderly neighbor, doing their shopping for them, keeping them out of our hospitals, that's delivering healthcare. That makes everyone at home front lines. And I think this is a real chance for our nation to look around at our neighborhoods and our communities and look inside ourselves and figure out all we can do to take care of those who are vulnerable around us.
Yeah, that's an amazing point about sharing responsibility in the community. And it's not just what can we do to help you, but we can also help you just by the way that we are behaving as well. We have Kamal in the stream who says, all these frontlines are heroes and they should be awarded Oscar and Grammy Awards. I'm not sure why not a Tony or something else too, but those will be coming to you soon. Let's see. Vina says, God bless you to the healthcare workers. Nicole says, you all inspire me so much. So you are inspiring our stream community here on LinkedIn right now. I think it's been wonderful talking with you. I want to do a lightning round. I want to ask one question of all of you before I let you go back to the very important work that you are all doing. I'm wondering, with states reopening, we see a lot of questions in the stream about safety. What is the one thing you want people to know, to take away from this chat today, about whether you're in a really hotbed situation or you're in a place that doesn't have a lot of cases? What do you want people to think about as states reopen? And we have a lot of questions about how are people going to remain safe and confident. Rosemary, let's start with you.
Yeah, I definitely piggyback a bit off of what Dr. Griggs has stated about looking out for your neighbors, thinking about others in this time. With social distancing, I don't like to call it social distancing. Instead, it's more physical distancing, because being social is more important than ever. What I would like people to do, though, is like, if you have masks to donate, or like you want to do something to support healthcare during this time, I really would implore you to think about the most vulnerable populations, the homeless. Like, so if you have extra masks and stuff like that, okay, donate it to, a homeless shelter or a food kitchen, or someone you see on the street, who doesn't have a mask. And with crowding on buses, I see that a lot. And I just really want people to start thinking about that, because the buses are cut off at 50% of the capacity, and people are still really sitting very, very close to each other. And I just would like people to consciously think about, getting on a crowded bus, getting on a crowded train. Is it worth it? Or you could wait.
So we are anti-social distancing, pro-physical distancing. A big distinction there. You're still being safe, but you're still maintaining connections with people. Natalie, what about you? What do you want people to think about as they're wrestling with their states reopening and how they can move safely, feel confident about how they move through the world?
Well, I would agree around the social distancing. Wearing masks is about protecting other people, not just yourself. But I think the other thing is if you don't feel well, stay home. And if you have a temperature or symptoms, call your doctor and go in and be seen. Because I think that sometimes people think that they're okay and they power through. And we really have to be careful about not sharing the virus with each other.
Yeah. So same question to you, Kathy. What do you think?
In mind, this, when they start to open and reopen things, this is going to be with us for months, years, until they get a vaccine, or till we can get our community immunized, or at least, have antibodies for it. So we're going to have to be cautious and to be careful and wash your hands, be cognizant of what Natalie said, wear your masks, and help support people who are really hurting. One thing as a nurse, I thank our viewers for all the nice comments, but I feel like, we have a job, we're getting paid, and there's so many people through this who've lost their livelihood, and that our food banks and others need our support continuously for the next, foreseeable future.
Kathy, that's a wonderful message. Thank you for that reminder for everyone that this is your job. I know you didn't expect this to happen when you became a nurse all those years ago, a global pandemic, but it is the work that you sought out in life. It's your work, and a lot of people aren't in that situation. That's a wonderful reminder to support your communities. Dr. Griggs, I want to end with you. What is the thing that you want people to know as states start to reopen and they're thinking about navigating a new normal?
Yeah, I think it's really important to convey the message that the same recommendations for masking and hand washing that everyone has emphasized still apply. I've been in the room of hundreds of patients who are positive for COVID, and I'm wearing a mask, I'm wearing a paper gown, and I'm wearing gloves, and I still don't have antibodies. So masks and hand washing works to protect yourself and others. So that should give everybody confidence, but not too much confidence. It means you still have to be really careful, wash your hands as often as possible, wipe down common surfaces at home as things reopen, and just know that even though we may be less scared, the virus hasn't changed. But that being said, everyone should know that we are getting smarter and better at the hospitals. We're learning how to manage the influx of patients. We're getting smarter at treating the disease. And if you are at home and you feel sick, by all means, call your doctor, seek care. Our emergency rooms are clean and they are safe. And if you need to come to the emergency room, please come. Don't struggle at home.
Yeah, it's nice to hear that there's still simple, very actionable things that we all can be doing to stay safe and keep others safe. Before I let you go, I need to tell you that Joshua says you ladies rock. Thank you. And we have Nicole who says, I am a CMA, and because of you ladies, I want to go further in my education. You all are my inspiration. So thank you so much for being with us today. Thank you for inspiring Nicole to keep pursuing her professional dreams. I'm so glad to have had you on the show today. Thank you.
Thank you.
Thank you.
Yeah.
That was Kathleen Williams from Springfield, Missouri, Natalie Carell-Yoder from Fairfield, California, Rosemary Yetman from New York City, and Dr. Cornelia Griggs, also from New York City. I'm Susie Jackson. This has been Business Unusual, LinkedIn's live show where we talk about the ways coronavirus is impacting the way we work. You can catch us 5 days a week from the LinkedIn editors page at 12 noon Eastern. Except for this Friday, we are taking a short break. So we will see you back here soon. Thank you so much.